Alright. Hi, my name is Natalie. I work for the Colorado Dental Assisting School. This is Hannah. She also works for the school. And we are going to take an FMX. So I'm just going to put on my PPE. So for x-rays, I'll just be using a mask, a lab coat, and gloves. And then for Hannah, my patient, all she needs is a lead vest with a thyroid collar. You want to make sure your patient doesn't have any earrings in the way, any jewelry like tongue ring, or well, tongue ring's okay, but anything on the outside, on the lips or eyeglasses might get in the way. So then we're going to place our barrier on the sensor to protect it, and we're also going to put one of the fingers from one of the gloves on here to help hold it on, and also when we're switching our tabs here, it'll help it so it doesn't rip the barrier underneath, and then we would have to replace it every single time we put on a new tab. So we'll just stretch this guy over it. Next, I'm going to set up my rin. So I have a Bitewing rin, and remember you want your two little prongs here facing inward. And then we'll get the Bitewing tab, place it on our rin, make sure the ring is facing the right direction and that the tab is dead center in the middle of the ring. And then we'll set up the posterior. So this is going to be for the upper right is where we'll start first. And then we'll place the tab on here. Remember, the bar is going to be facing outside of the mouth. And then you can see that the tab is right center in the middle of that one. We'll go ahead and put our x-ray sensor on, and notice that the cord is going the same way as the bar as well, outside of the mouth. So we're going to start on the upper right posterior PA. Okay, you ready, Hannah? And bite down. You want to make sure that your bar is parallel with your x-ray head. Alright, and then we're going to move up to the premolars bite. And then notice how I push this down and hold on to the bar with the same hand. If you just push this while she's biting, it'll probably move the rin in the mouth, and it could possibly scratch her or hurt her. You don't want the sensor to move. And open. Alright, so we're going to go down to the lower left now. We don't have to change the rin at all. And we're going to do posterior first. And bite down. You okay? Okay. If it's jabbing Hannah, she's going to let me know, and then we'll probably just use a 2x2. Open. Then we're going to move to the premolars. And open. Alright, now we're going to switch our rin. So it's still going to be going this way in the mouth. I haven't changed the ring yet. All you're going to do is flip your ring over and make sure your tab is facing upper, because we're going to start on the upper left now, and then we're going to put our sensor back on, and we'll start on the upper left posterior. small mouth, so we don't really have to move it too much. And open. Alright, now we're going to do the lower right. And notice how we're moving the x-ray head in front of our patient. We don't want to bring this x-ray head around because we don't want to smack Hannah in the head. She wouldn't be happy. Come right down. Alright, so we're going to do posterior, lower right. We'll move to the premolar anterior area. Right down. Is it jabbing you?
Uh-huh.
Okay, open. So if it's stabbing your patient, you want to reposition the x-ray rin and the sensor because this area shouldn't be stabbing them in the gums. It should just be the sensor touching their gingiva. So, bite down. Is it still getting you?
Uh-huh.
Okay, open. So we'll grab a little 2x2. See if that helps us. Is that better?
Mm-hmm.
It's important that they're comfortable, at least where they're not in pain if they're moving. Otherwise, we're not going to get a good shot. And open. Also, you can tell your patient once it's done beeping, you can go ahead and open if that makes you more comfortable. And them as well. Alright, so now we're going to switch to our anterior. And you want to make sure that the tab is, again, right smack dab in the middle. So I didn't move the ring, I just put the tab on. Now we're going to place it on our sensor. I'm going to line up the bottom here because the cord's going to be going the same way as the bar, outside of the mouth. And we're going to start on number 6, the upper right canine, and bite down. So you can see how the ring is not hitting her in the face at all. That's how you know she's biting on the bite tab. Bite down. Open again. Open. And bite. There we go. Open. Alright, now we're going to just flip it over. We don't have to change the ring, and we'll start on number 22 on the lower and bite down. You doing okay? Open. Bite down. Sometimes the cord will start to move this sensor as well. So. Alright, and on the lowered anteriors, you want to make sure that the cord isn't in the way of your film. So don't let the cord go in between. Alright, ready? Bite down. Bite down. And open. Okay. Now we're going to move on to our Bitewing films. You want to place your tab right in the middle of the sensor so we have even amount of the maxillary teeth and the mandibular teeth. And remember, the cord is facing the same way as the bar, outside of the mouth. We're going to start on the molars, so posterior first, and we're going to do 2 on each side. You want to make sure that your x-ray sensor, or your x-ray head, is parallel with the bar again. Now we're going to move it forward just a little bit to her premolars, and bite down. Okay, we're going to switch to the other side. We do not have to change this rin. One more posterior. And that completes our full FMX of 18 films. Good job, Hannah.